Kylie Jenner denies having all facial plastic surgery except for facial fillers. Do we believe her? Kylie Jenner's face has changed fairly dramatically over the years, and it seems to be due to probably a little bit more than just fillers. Nothing against her. But looking at her face, we can see that she started out with a rather rounder face with features a little bit out of balance. Then she kind of morphed into this very proportionate, heart-shaped face with features that are definitely more defined, sculpted, and imbalanced. So I'm very suspicious for several different procedures. I think looking at her starting from the top down. So if you look at her eyes and her brow, we do see some reshaping there. You see that the upper lips have gone from heavier upper lids to more open and raised upper eyelids, so it is a little suspicious for an upper blepharoplasty, which is an upper eyelid surgery to open the upper eyes. Some of that could be due to some Botox and some lifting and reshaping of the brow, but the upper eyelid is a little suspicious for that. Then if we start looking more to the mid-face or to her nose, we also see that the nose has gone from a wider nose to a more defined nose, particularly in the bridge and the tip. And again, that doesn't occur naturally. So I am suspicious that at some point she underwent a rhinoplasty. Then if we go down to the lower part of the face, I think there's even some more dramatic changes there. We see that she had a really strong chin. That strong chin is getting a little weaker and more defined in shape. And that again is something that doesn't just happen on its own. So there are some procedures where you can reduce the chin, and I'm a little bit suspicious for that because we can see that it was just so overpowering, and then it comes into just a much more feminine, elegant, balanced chin and jawline. So I'm a little suspicious that something maybe was done to the chin itself. And then of course, one of the things she's most famous for is her lips. And when she was younger, we see that her upper lip was very thin and out of balance from her lower lip. And she's admitted that she's had fillers in her lips. And I do think that was done well and balanced out her upper and lower lip. And then as far as not plastic surgery, as far as the fillers, yes, I definitely think she's had fillers in her face, particularly to highlight the cheekbones and bring that mid-face into balance with the rest of her face. Again, taking that sort of bottom-heavy face and flipping it to a heart-shaped face. Overall, I think it's very well done and very balanced. I do want to comment that a lot of people think she had a buccal which is taking out the fat pad from the lower face. It's possible, although from younger to older, that naturally comes in a little bit. And if she did reduce the lower face, it may have come in naturally with that. She did have those heavy, kind of chubby cheeks come in and be more contoured. So there is a small possibility also of a buccal. I do have to add one other little caveat to that, which Kylie herself has admitted to, which is she does a lot of filtering and changing of her own face by editing. So we can see in some photos her face changing throughout the years, where the nose is smaller, bigger, different features, smaller, bigger, eyes bigger, cheeks bigger, smaller. So some of these changes that we're seeing also can be due to her own photo editing, but I do think some of the overall changes are also probably due to some plastic surgery.